Welcome. Good evening. I'm George Galloway. I'm the leader of the Workers' Party of Britain. And as you possibly know, I'm in Batley and Spen fighting a by-election for the Workers' Party and doing very well. You can measure how well by the conduct of our opponents, which is becoming increasingly desperate, even recklessly desperate or desperately reckless, to a point which is quite startling, actually, and must be startling to their erstwhile supporters. Keir Starmer, the new Labour leader, is set to tumble, set to come a cropper at this by-election, having lost the Hartlepool by-election just what seems like a few weeks ago, and having presided over disastrous Labour local authority election results in the north of the country. And one of the reasons for that, I'm not the reason, I may be the proximate reason for his overthrow, but this has been building for a very long time. Because new Labour is essentially no different to New Labour was under Tony Blair and Gordon Brown. There was a brief interregnum. Dr. Bob and Dr. Ranjeet might call it a temporary resuscitation that took place under Jeremy Corbyn, but Jeremy Corbyn's been kicked out of the Labour Party now, and it's back to the future, back to the future that was once Tony Blair and Gordon Brown. The difference is that at least Tony Blair had a bit of ability to do the job. Keir Starmer is a poor man's Tony Blair. He is Tony Blair without the laughs, Tony Blair without the polish. No one would cross the road to follow Keir Starmer, and I think the great majority of Labour members and Labour supporters in the country already know that to be true. And one of the things about continuity Blairism is their infatuation with private markets. And it was Tony Blair, don't forget, who accelerated within the National Health Service the trend towards marketization, privatization, part privatization, and public-private partnerships of various weird and wonderful kinds. Of course, he didn't invent it. Margaret Thatcher invented it, but I think I can say, my expert colleagues will confirm or otherwise, that Blair accelerated that process. He made an art of it and spun it as a wonderful thing. The savior of the National Health Service were these PPE contracts that were signed with private businesses, which are, of course, now seen very, very widely as an albatross around the neck of the National Health Service, eating up a very substantial share of the NHS's budget, and of course, paving the way to the complete privatization of the NHS, if they could get away with it, for the Conservative government under Boris Johnson and Rishi Sunak and I think Matt Hancock, but I can't be sure, I haven't seen the news yet. So the Blairites have played a seminal role in the destruction of the National Health Service as we knew it, which was once, of course, Britain's finest boast and Labour's finest boast. That they had introduced the National Health Service was indeed a transformative and wonderful thing. But how ironic that it is Labour in its new Labour form that has both executed a substantial part of the murder of the National Health Service and paved the way to its final expiration. My friends are the experts in this field. I know them both very well. Dr. Ranjeet Brar is a comrade of mine in the Workers' Party, one of our leaders, one of our foremost spokespeople, not just on the National Health Service, but of course, as a surgeon, as an NHS doctor, he very often finds himself speaking to our policy on the health service. Dr. Bob Gill is not yet, I think, a member of the Workers' Party, but we definitely hope to recruit him at some stage. But he is the maker of the fine film, The Great NHS Heist, and speaks around the country about the kind of issues I am foreshadowing here. He is a general practitioner who has, I don't know if you'll thank me for saying this, but he has put his career on the line to stand up to this murder of the NHS. Too many of his colleagues have gone along with it. Too many of the Royal Colleges too have gone along with it. Hardly any of them openly and vocally stand up against it. And that's a very great disappointment. And I'm sure Dr. Bob will talk about that. We see this whole process located in the bigger picture of the Thatcher, Blair, Brown, Cameron, and Johnston belief system that public is bad and private is good. That if it's public, we should let the private sector get as much of it as they can. And that it would be much better for them and their friends if they could get access to this dripping roast, which is the NHS. I myself was relatively unaware until seeing Dr. Bob's film of the sheer scale of the rich pickings which are there for private companies, insurance companies, and companies supplying the NHS and profiting from it from one form or another. And that's, of course, before you even look at the issue that is perhaps extraneous to this meeting, but which is, to me, of lifelong importance. The Workers' Party stands for the public ownership of the pharmaceuticals industry, because it is absurd to have a public health service and a private pharmaceutical industry. Because, of course, one of the most significant costs to the National Health Service is the cost of drugs, medicine. And to allow private companies to effectively set their own prices, at least for the length of time of their patent, for vitally important parts of the NHS, like drugs, like medicine, is clearly absurd. And think how much more expenditure would be available at the front line of the National Health Service if we were not paying big pharma the fantastic sums to make fantastic profits that we are. Again, extraneous, the Workers' Party also stands for the integration of the National Health Service and the social care sector, because that too is ineluctably linked to the National Health Service. We all saw the cruel and unusual situation where during the recent crisis of all crises in the NHS, where old people were being moved out of hospital into care homes, ill-clad, ill-prepared, ill-protected, into care homes in which they themselves, in thousands of cases, expired and passed the virus that they had on to many, many others, including the staff who work in the privatized care home system through no fault of their own. I mean, no criticism of them at all. But we believe in, as it were, the integration of all aspects of health and social care, including the care home system and including the pharmaceutical sector. Now, as I said at the beginning, I'm on the election campaign trail. And so for that reason and others, I'm pleased to hand over now to my comrade, Dr. Ranjeet Brar, who will conduct the rest of the meeting. Dr. Ranjeet Brar of the Workers' Party of Britain. Over to you.
Thanks so much, George. Rob, are you hearing me okay?
Loud and clear.
Fantastic. I think George has made some fantastic points there and a fantastic introduction to the meeting. I woke up this morning, I don't know if anyone else reads the Times, many people don't read the Murdoch press, but I read all of the press, to a headline which bemoaned and bewailed, perhaps denounced parents across the nation. It said, children with mild fevers, but children are clogging up the A&Es of our country. So after the pandemic, children are again mixing with the community and other children, and they're getting a lot of respiratory problems, and they're going to seek medical advice for this. And on Radio 4's Today programme, a senior member of the A&E fraternity, a colleague, was encouraged to come on and explain that it was wrong to bring your children to A&E. But why is that happening? We are seeing it's a product, it's not something that's come out of the blue. It's a product of a perfect storm of circumstances, which has led to an incredible downgrade in the capacity of the NHS to see patients and deal with patients, which is not purely a product of the pandemic itself, but the result of 40 years of policy to deliberately downgrade the NHS. We have gone from having close to 250,000 beds 30 years ago to now having actually only 100,000 acute care beds. So, of course, if you reduce services, reduce staff, and reduce pay and conditions of workers, you reduce access to the working class to healthcare. And by so doing, people can't see their GPs, and increasingly people are having real accessing their GPs, having face-to-face appointments, getting the care they need. What's their next port of call going to be? It's going to be A&Es. A&Es themselves, which are straining, which have winter crisis mode now permanently on, which have winter crises during the summer, which are in permanent gold watch, black watch, platinum watch, these codes which are put around for the fact that they can't clear patients out of A&E because they can't admit patients to hospital because hospital doesn't have the capacity to treat all of the patients that need care. This is a perennial problem of our NHS, and it's a problem which is not accidental. It's not a problem because it's a public service. It's a problem which is there by design, and it's there by design to use as a tool to actually further introduce inroads into the NHS and further privatisation. George, of course, is standing in Batley and Spen. I have talked now to George for some time on his show, MOATS, the mother of all talk shows, which runs every Sunday night, and I encourage people to tune in and see the political commentary that is there. Millions of people now do, and it's an alternative to the mainstream media, which is a valuable resource and contribution. But I've spoken to him and explained some of the many problems that we've seen throughout this pandemic. And along with all of those changes, there's been downgrading. Bob himself will tell the story of how his local hospital, how did Bob come to be involved in politics? Bob was a GP. Bob cared very much about the care of his patients, as all doctors do and as all doctors should. And he found that care was being degraded at his local hospital, which is Queen Mary Hospital in Sidcup. A very similar thing is happening to the Dewsbury Hospital in Batley and Spen. If you look on the internet and have a look, you can see from 2013, 2015, 2017, repeated attempts to downgrade what was a busy district general hospital serving Batley and Spen area in favour of centralising services. There were threats to maternity, threats to paediatrics, threats to the accident and emergency service, threats to downgrade A&E to a walk-in centre. Those haven't quite come about as yet, but they have moved the intensive care and high dependency units out of Dewsbury Hospital to Pinderfields. And that centralization, that taking away of services, the downgrading of the maternity service, the threat to the pediatric service, this is what has happened. It's a microcosm of what's happening across the whole NHS, the centralization of services, the reduction of capacity. And then, of course, when a crisis happens, as we've seen in the coronavirus pandemic, there isn't the capacity to deal with the problem. What was it that triggered lockdown in this country? It wasn't just the fact that COVID was out there. Not every country had lockdown. It was the fact that, one, our government didn't institute sufficient public health measures to isolate the virus before it spread to the population, which was perfectly possible had there been the will to protect working people, support working people, and just follow fundamental management of pandemic, as would have been advised by the NHS. Rather, there was the will from the very beginning to promote herd immunity, protect the economy, and if a few people, old people die, pensioners die, so be it. They were literally the words of the advisor of Boris Johnson, who's now fallen out with Boris Johnson and is denouncing Boris Johnson, exposing the incompetence of Matt Hancock, but nevertheless revealed the thinking of the government, which was to allow the virus to spread, let the old people die and protect the economy. Now then came a crisis of global proportions, actually an economic crisis, which forced intervention. And billions were given to companies by way of subsidies. The furlough scheme is a temporary unemployment scheme, but principally designed to prop up companies. Billions was given to track and trace by Tory grandee Dido Harding. And that's probably 45 billion in the order of. And we will be paying for this through the nose. But what wasn't done was sufficient funding given to the NHS to have sufficient capacity to deal with the problem, to be able to quarantine patients who had the virus away from patients who needed elective care. And as a result, our NHS was overwhelmed. It essentially shut down access to normal services while it dealt with the pandemic. And because the hospitals were overwhelmed, that was the factor that led to lockdown. This was entirely avoidable. It was avoidable if we'd looked at Operation Cygnus, which happened in 2016, under the leadership of Jeremy Hunt, then General Health Secretary, Conservative Health Secretary, who saw in an exercise simulating this pandemic, that the NHS would be rapidly overwhelmed, had lack of capacity, lack of beds, lack of staff, lack of PPE, lack of ventilators. And what was their response to that? 2016, so just 4 years ago, they realized what was going to happen. What was their response? To suppress the report. Not to do anything about it, not to increase capacity, not to change the direction of flow, because their overwhelming priority was decrease capacity, because by decreasing capacity, you introduce rationing. By introducing rationing, you force people into the private sector, and that was their goal, to get this huge source of government funding into the private sector, into the arms of their friends. So it's directly 40 years of policy, a cooperation between Labour and Tory, but pushed in the last phase by the Conservative government very hard, that led to the problems of the pandemic. And it's remarkable to me, an irony, really, that there's a so-called vaccine bounce, that the Conservatives are getting credit for the vaccination. So this is, vaccination is an old technology, 200-year-old technology, which has been the only tool that has been introduced that has effectively worked against coronavirus. It wasn't the only tool available. Public health measures were available. Increasing capacity of the NHS was available. And again, who has really delivered the vaccination program? It's not the Conservative government. It's not Matt Hancock when he jumps up and tries to take credit for it constantly. It was delivered by the NHS. It was the one aspect of pandemic measurement which was delivered by the NHS, apart from the research, which again was publicly funded, though the profit from the vaccine will be taken by private companies overwhelmingly. So on every level we look at this, the pandemic and what the country's been through over the year and a half is not a success for the Tory government. It's an exposition of the gross negligence of the programme of privatisation, the Tory government, and the collaboration and cooperation of the Labour government in that during the Tony Blair years. That's all I'm going to say by way of introduction. But this is not over. If we've seen huge grants or huge amounts of money being doled out by Matt Hancock to the private sector, there are plans afoot in Matt Hancock's white paper to sustain that programme of giving away public money, not to the NHS, but around the NHS, which is degrading, far from the slogan of this government, which has been most fallacious of stay at home, protect the NHS, save lives. They've not been protecting the NHS. They've not been protecting lives. Many people have died at home because they've not been able to be treated by an NHS now, which is starved of resources. So to explore exactly what's happening with the white paper and to bring us right up to date with Matt Hancock's current plans, it's my real great pleasure to introduce Bob Gill, campaigning GP and director of the fantastic movie, The Great NHS Heist. Bob, thanks so much for joining us.
Thank you, Ranjeet. Thank you for your introduction and your summary of how we coped with the pandemic, or rather didn't cope. The reason I became politically active, you hinted at, it was following the downgrading of a local hospital, and I understand in Batley and Spen, you're facing a similar outcome, and it's very difficult for ordinary people to really believe that our government is actively having plans which will jeopardize the lives and the health of the population. But that is exactly what is happening. It happened in Sidcup when we lost our A&E department, our maternity department, and the medical beds. That led to the hospitals that were remaining becoming chronically overstretched. And what did that mean for patients of mine? They often were not admitted when they were seriously sick. If they were partly recovered, they were discharged prematurely. And the pressure on the doctors and nurses within the A&E departments has become so intense that they make more and more mistakes. And that results in harm to the patient and in some cases, preventable death. And it's the preventable death of several of my patients that spurred me to become active. This is not by choice or boredom or lack of other things to do. It's desperation to try and prevent what happened to our local services happening across the country. So what faces us now? George referred to private finance initiative under New Labour. New Labour did a lot of other damage, not only saddled the NHS with private debt, which got more and more onerous, but it reinforced the private sector bureaucracy within the NHS, which was estimated in the mid-2000s to be leaching out 10% of the budget. And that was then. Believe me, it's got much worse. So the last 30, 40 years, the NHS is really a shell of what it could be and should be. The leadership is predominantly in favor of privatisation. The vast majority of the staff are too busy and have not been told by their own representative bodies as to what's going on and still don't realise what's afoot. And the opposition, certainly Starmer's Labour, is totally silent about what is really going on. And the next step of the privatisation is, in fact, to replicate the American, what is called over there, managed care. Now, this is something cooked up by the private insurance companies, and in this country is being led by the world's biggest insurer, health insurer, United Health. And they have a UK subsidiary called Optum. Now, you may also find it interesting that the chief executive of NHS England is a man called Simon Stevens, who spent 10 years at United Health before he was appointed in 2014 to lead the NHS. And his last position in United Health was for President of Global Expansion. And the legislation that is soon to be put before Parliament will, if the white paper is anything to go by, enable this insurance company to gain control of all NHS budgets. What they're proposing to do is to create 42 integrated care systems, not the sort of integration that George wants and we want, which is true integration of services run for public benefit and publicly provided. That's not the integration they're interested in. They're interested in integrating all the budgets from health and social care into the largest available pot from which they will extract a profit. So there will be fixed budgets for these integrated care systems, and they will have a duty, they will have a responsibility to make savings. And to me and you, that's profit. So the incentives will be to deny care, to further asset strip the NHS, to sell off land and buildings. And most importantly, these companies will have control of your patient data. And that data, using algorithms and data analytics, will be used to decide what care you get. So we will have a deadly computerized postcode lottery in the hands of companies from America, which have settled multi-billion-dollar agreements with the courts without admitting liability for alleged fraud of public funds. And in America, their equivalent of publicly funded healthcare, although privately delivered, is Medicare and Medicaid. So what is afoot is the conversion of the NHS into a Medicare-style system, run by private insurance companies and delivered by private companies, as NHS staff will gradually be handed over to the private sector. The other toxicity within the NHS bill is something called discharge to assess. Now, this might sound very harmless, but what it actually means is they will remove the legal duty to make sure it's safe to discharge you or your relatives home. In fact, creating the ability to dump patients unsafely, either in their own home or in the streets. Now, this is something that goes on in America and has been well documented. In terms of access to services, well, the easiest way to prevent you accessing service is to close down the service, to remove it, to physically remove your A&E. It becomes harder to access. But they are also going to erect another barrier through the telephone line 111. There's a new service being set up called 111 First, which you will have to seek permission and approval before you attend A&E. Now, this is an electronic, a telephone operated barrier for your access to hospital A&E services. In terms of GP service as well, you know, Ranjeet set out how overrun the service is due to chronic defunding. The perfect storm of the coronavirus has added to the pressure. But also what has happened in 2019, the GPs were hoodwinked by our own union, the British Medical Association, into signing up for new contracts. And these new contracts will, over time, turn GPs into salaried employees of the primary care network, removing their independence, and over time, replacing GPs with non-doctors. So in fact, the right patients have had to access a doctor as first port of call will be removed. That right that has existed since 1948 will be removed. You know, I would challenge people to remember the last time they were able to access their GP being the same doctor on 2 consecutive occasions. It's become a rarity. Continuity of care has been gradually eroded from the NHS, but with continuity of care comes patient satisfaction. It builds a doctor-patient relationship, but most importantly, there is strong evidence that it reduces the chances of you dying. Continuity of care is good for your health, but that has been shattered by the multiple reforms that the NHS has gone through. Now, if that wasn't bad enough, there's proposals in the new bill to deregulate the professions. So you'd no longer need to be qualified to deliver healthcare. So this is a toxic combination of putting insurance companies in charge of the budgets, having these integrated care systems dominated by the private sector, like Deloitte's, like Serco, as we've seen with the test and trace, squandering billions of public funds and delivering very little. And the lessons they are learning from the pandemic are all the wrong lessons as far as the public interest is concerned. They will normalize the awarding of multi-billion pound contracts to cronies without any overview. And the final thing in the bill is to remove a section of the Health and Social Care Act from 2012, which made it compulsory to make this tendering process public and open to public scrutiny. The bill will remove the necessity for this to be an open process. So in effect, removing the final hurdle, the final barrier for allowing a private sector monopoly to operate within the NHS. Now, none of this is being said by the Labour front bench. In fact, the last thing I heard John Ashworth say was that he had no opposition to the integrated care systems, but he didn't like the fact that Virgin were going to be on the boards. Now, this is a total misdirection because they're not mentioning the great elephant in the room, which is the American private insurance industry. And as time goes on, once the insurers have their feet under the table, the services that are available on the NHS will diminish, and there will be an increasing driver for people to take out top-up private insurance to replace those services that are no longer available on the NHS. So, I welcome the prospect of George winning this election, because I know with him in place, with him having a voice in Parliament, we will have at least a chance for hearing the threat that our NHS is under. He has been a defender of public services. He's been on the right side of many major political issues over the years, and we need a strong, articulate defender of the NHS. We certainly don't have many of those at the moment in Parliament. Back to you, Ranjeet.
Bob, thank you so much for your eloquent contribution. So Bob's movie, of course, is called The Great NHS Heist. And if I was going to summarize the whole essence of what we've been talking about, is precisely that global capitalism is stalking the earth, looking to maximize its profits at workers' expense. And one of the big ways they've found to do it is to rob the services provided by the state, just to reduce the social wage, which is essentially to tax workers. And there's an incredible, and it's a conspiracy because it's against our interests, and they're not telling us openly it's what they're doing. And it's not just the Tory party who are the open enemies of socialism, open enemies of the NHS as a Stalinist institution. They have declared their enmity to it pretty much openly. Boris used to declare his enmity to it. He used to say there's better ways of doing it. He used to say, if you can go back in the archive, you can see him making speeches in Parliament denouncing the NHS and saying there's better ways to do it and we need to privatize it. But now they've struck upon a better technique. They simply pretend they're improving it whilst robbing us blind and decreasing the service. And every year, I've been in the NHS as a surgeon, as a trainee, as a doctor, as a junior doctor, a registrar, consultant surgeon for 20 years. And the service has only been getting worse. Despite all the increased budget, smaller amount of service available at the front line, more and more money siphoned off. George mentioned the pharmaceutical industry, more than 20 billion a year. Management changes, which were supposed to bring efficiency of the market, have spiraled to the point they're more than 20% of the NHS budget. Huge waste of money on internal market and all the rest of it. So we are talking, and PFI, billions a year. We've taken a mortgage out, which will take us, we'll have to pay back 6 times what we borrowed. We borrowed 12 billion to build hospitals. We'll pay back 92 billion. And at the end of that, we won't own the house. We won't own the hospitals. The hospitals will still belong to the private sector. And now, from peripheral services being privatized, used to just be the dinner ladies, used to just be the cleaners. Everything's up for grabs. Everything's up for grabs. And if companies don't get their way and they don't get the money that they wanted from the NHS, they can take us to court because they feel they were treated unfairly. It's a great robbery. Labour have facilitated it. It's remarkable to me that in elections, people don't speak about it openly. George is a breath of fresh air, facilitating this movement, facilitating our ability to talk about it. But the problem with it has been, with the movement to try and defend the NHS, and there have been many good people trying to defend the NHS. The problem has been they've seen Tories as the enemy and Labour as the friends. But the reality is that the two have been working hand in glove for the last 40 years to destroy the NHS. We want a strong voice in Parliament to defend, to speak up, to expose, that can't be silenced, because there's a complicity also of the mainstream media. And one of the only ways we can effectively get around that and get our message to the people is by having a voice in one of the only places left to speak with privilege about these matters in Parliament. For that reason, Bob is not a member, I would say, of our work. I am a member of the Workers' Party. I have been campaigning in Batley and Spen. I will continue to do so. If we can get George elected, he will be worth more than the other 649 MPs as far as the NHS is concerned, and on many other issues, because it's a conspiracy of silence. As Bob said, the elephant in the room is our NHS is being stolen before our eyes, but what they hit upon is the idea that you leave the badge the NHS while you rob us of the service. And we're all wondering what's happening. They want us to fight, to say it's immigrants taking away the NHS, to stop immigrants from getting access to care. But actually, we're all being robbed and we're being misdirected in a number of ways. So thank you, Bob, for your fantastic contribution and all of your work. I would encourage everyone to watch Bob's movie. Thank you, George, for your work, because we need not only to campaign in the sphere of the NHS, but we need a voice that can rise above the conspiracy to defraud us of the service that we all know and love and want to defend. And with those words, I'll close the meeting. Thank you very much for joining us this evening.